Hi, everyone. Welcome back. Today, we're joined by Dr. Eddie Stenehjem to give our update for the community on what's been happening in the past week with COVID-19. Eddie, thank you for coming back. We really appreciate the time.
Of course.
So, as always, I want to talk about numbers first. Again, these numbers are reported from yesterday. Today's data has not been released yet. We're going to talk about overall counts and then the daily case counts as well. So, our overall case counts in Utah as of yesterday are 18,784 with a daily case count yesterday of 476. We're up to 163 deaths and 1,256 hospitalizations throughout this period of time. Let's talk a little bit about what that means. As far as hospitalizations and positive rate counts, how is Utah doing?
Yeah, not well. I wish I could sugarcoat it or have really better news to tell, but we're in the midst of what's looking like kind of exponential case count growth. At the end of May until really kind of May 27th, we were averaging between 150 and 200 cases per day, and at that point we had did what we had set out to do. We had flattened the curve. That's exactly what we had wanted. And then really kind of May 28th and onward, we've just seen a steady increase in cases. We hit about 5-6 days ago a case count of over 600. We're now at 476 today, and we're just seeing this curve really kind of skyrocket upward. And it's what's being seen in a lot of other states too. We're not alone in this. We've seen this in Florida and in Texas and Arizona. Texas and Arizona has had daily case counts of 5,000. That's what New York City was seeing at the height of its epidemic. So we're really in a really dangerous position right now, and it's really upon us to do something to course correct, because what we're seeing already is that hospitalizations have increased. And so if we look back, in the Intermountain system, we're averaging about 80 patients, 70 to 80 patients per day at any one time in any of our hospitals with COVID-19. And now, 4 days ago, we had 150 patients in the hospitals. Today, I think we had 140. So we've almost doubled the amount of hospitalizations that we've had for COVID-19 in the past month. And keep in mind that hospitalizations lag about 5 to 7 days after a positive test. But clinically, typically the way it works is you have a 5 to 7 day incubation period that can be as long as 14 days. Then you get your diagnosis, and then 5 to 7 days after that is typically when you get hospitalized. And so we're anticipating to see increases in hospitalizations even this week and definitely into next week, especially if case counts keep going up.
So with those hospitalizations too, that's current hospitalizations. The 150 you said are roughly that number. That's not in the past. That's right now in Intermountain system.
Yeah, right now in Intermountain system, as of today, as of yesterday, we had 135 in our hospitals. That hasn't been updated yet today. This morning, we virtually rounded on 45 COVID-19 patients at Intermountain Medical Center. Well over half of those were in the ICU. And those numbers keep going up. We've been doing daily rounds at IMC across all our systems, but I've been doing them at IMC, and typically we had about 20 to 22 patients in May, and now we have upwards of 40 to 45. And so clearly seeing an increase in hospitalizations. Currently, right now, we have the capacity to care for these patients. These patients are receiving the best care that they can receive. They're receiving the care by intensive care unit docs, by trained respiratory therapists with infectious disease rounding with them, and they're receiving advanced therapeutics. But, and this is a big but, if our case counts continue to go up, we're really going to be maxing out our capacity in the coming weeks, which is forecasted in the next 4 to 6 weeks if nothing changes.
I also really quickly want to talk about ICU bed space too, and correct me if I'm wrong about these numbers, but I do believe Utah has 500 ICU beds statewide, which I thought was pretty low, but apparently it's pretty in line with per capita and how many people are actually in the state of Utah. So with those hospitalizations currently in our system and other systems, not all of them are in the ICU though, correct?
That's right. If you look at the state data shows about 40% of people that get hospitalized actually go into the ICU. And so, no, not everybody that has COVID-19 in the hospital hits the ICU. That number is right around half.
Okay. So switching gears a little bit too, I want to talk a little bit about the protests. There was a recent report that came out of Minnesota. The Wall Street Journal reported on it, and they had a sample size of 8,200 people that self-reported that they went to the protests, and only 0.99% of them actually tested positive for COVID that they could trace back to getting the virus
Mm-hmm.
from the protests. Yesterday, during the governor's presser, Dr. Dunn mentioned that only 2 people in the state of Utah that said that they went to protests can actually say, I got the virus from the protests. I think that's kind of interesting. A lot of people thought that the spike in numbers was because of these protests, but it turns out, at least initially, and from what we know, it's not. Can we talk a little bit about why you think that is the case? Have people been why masks work, since a lot of the protesters
Right.
seem to be wearing masks, and what that means for the fact that we are spiking and it's not the protests?
Yeah, I mean, first of all, how reassuring is that? The fact that people that participated in these protests, are not getting COVID-19. That's, just we're ecstatic at that. You try to read into that, and what does that mean? And I think, you think about a couple of things. There were quite a few people wearing masks, which was great. I think it also speaks to the power of being outside, and the fact that these protests were not indoors. They were outside, and, we're getting more and more comfortable with the fact that transmission rates are probably much less outside than they are inside. You're just not concentrated. You don't have that exposure to respiratory droplets. So that's really reassuring of that case. And so, Dr. Dunn said there's only 2, and, that's been our experience too. We haven't seen any directly related to that. Again, it's hard to pinpoint exactly where people get COVID-19 at times, but that's reassuring. When you look at the state data in terms of where people are getting this, there's still quite a few people that are having known contacts in the home, and so are getting it from home, especially multi-generational homes. We are certainly seeing that, but there's an increasing amount of people where the contact tracing is not finding a source of the infection. And when that happens, that is true community-based spread. That's going out in the community and getting it unknowingly from somebody who you inadvertently are coming in contact with, whether it be socially or just, at a grocery store or whatever it might be. And so there's a growing number of that. In addition, what we're seeing is that, when the state health department goes out and does contact tracing, so if you turn positive, the state health department contacts you, and then they identify who are your close contacts in the
He's still alive. We're good. I just lost him.
Oh, what's up? You're still alive.
And for us, that the social distancing that had been in place back in May is really being kind of minimized at this point, which goes along with community-based spread.
Yeah, sorry, we lost you for a second. So if I randomly appeared on the screen, I apologize. But it looked like you were still live, so everything you were saying was so good. But I want to talk about masks because I think it's important with the community spread aspect. Yesterday's press conference with the governor was really interesting. There was a lot of talk about mandatory masks and figuring out how the state of Utah is going to react to that, what the processes are going to be like. He did announce that all state-run facilities, it is mandatory to wear a mask. So the DABC, which is the state liquor stores, counts as that. Any state building counts. So if you're going to any of these places, you are required to wear a mask when you're there. There's also a request from Jenny Wilson, the Salt Lake County mayor, to mandate masks in Salt Lake County. That hasn't been approved or denied yet. We're still waiting for results on that. But I want to debunk mask myths and really talk about these 6 things that I've seen going around on the internet that are pretty inaccurate. And hopefully by talking about them, people will realize that wearing masks will help. So we're going to talk about 6 different things. The first one I want to talk to you about is the fact that people think that wearing a mask decreases your oxygen intake, and that breathing through a mask decreases the amount of oxygen we need to live and be healthy, and increases your blood acidity and makes it more difficult to breathe. Let's talk about how that one is not accurate first.
Yeah. So yes, let's talk about these. That one is absolutely 100% false. So keep in mind that we have been wearing masks in healthcare for decades. And the masks that we use, surgical masks or these N95 masks, the masks that really have a tight seal and a tighter weave of material around it, we have people wearing these day in, day out for sometimes 12-hour stretches. We have surgeons who go through incredibly long procedures, sometimes 8, 10, 12 hours, without ever taking a mask off. And these people are operating at the highest level of their skill set. And these people are not dropping dead. They are not getting hypoxemic. And there's been plenty of studies to show, even with tight-fitting N95 masks, that you're not hypoxic, meaning your oxygen levels are not down, and you're not retaining CO2. We actually did this, a small little kind of experiment up in Park City, because we wanted to make sure that the elevation wasn't causing a problem with their tight-fitting N95 masks, and there was no change. So this idea that you're not getting the amount of oxygen through a mask or a simple face covering is absolutely 100% not true. The oxygen level that you're receiving is completely unchanged if you're wearing a mask versus not wearing a mask.
Okay, so the next one is increases toxic inhalation, which this myth says that toxins that normally we exhale as we breathe become trapped in the mask and re-inhaled into the lungs, increasing symptoms. Let's talk about that one.
Yeah, so I'm not sure what toxins that is referring to. We really like to put names on these things. So I think maybe what they're referring to is CO2. So a normal byproduct that we expel. CO2 easily diffuses outside of a mask, especially outside of a cotton face covering. And there's absolutely no data to suggest that wearing a mask causes increased CO2, or what we call CO2 retention. CO2 retention occurs in some pulmonary disorders where you can't expel CO2 well enough, but it's never been shown to be the case in masks. And so this CO2, removal, and you're not inhaling CO2, makes masks incredibly safe, and it's not a concern of any of ours in terms of universal masking.
That's good to hear. The next one is that masks shut down our immune system, which you've talked about the oxygen part, but this one specifically states that it decreases oxygen intake, increases carbon dioxide and toxin intake, putting your body under stress, releasing control, and shutting down your immune system.
Yeah, I don't even know where to start with this one. Your oxygen levels are the same. Your CO2 levels are not being, increased. We don't shut down immune systems. Like, that doesn't happen unless we give you chemotherapy, or we intentionally do it, or you get infected with a virus that attacks the immune system. There's absolutely no data that intermittent wearing of a mask does anything to your immune system. There's no scientific basis for that claim. And so, again, oxygen levels are fine. CO2 is not going up. That has absolutely no correlation with your immune system.
Another one that I keep hearing about is that it actually increases your virus risk. So if you have the virus, you're inhaling the virus again. I feel like that's an interesting one, because that's the point of wearing a mask, is that if you do have the virus, then you're not giving it to someone else.
Yeah, and I also saw part of that is that you have reactivation of viruses, which, again, no scientific plausibility for this. Yes, we all are infected with viruses. Some of them can reactivate, especially the herpes type virus. So HSV that causes cold sores, the things that VZV that causes chicken pox, or CMV, all of those can reactivate. Yes, absolutely. They usually reactivate in times of stress. But absolutely nothing in terms of a mask or a face covering causing any kind of viral reactivation. And yes, the whole point of wearing a mask is to prevent that virus that you have, that coronavirus that you potentially are infected with unknowingly, to be expelled into the environment, and it gets blocked by that mask. And keep in mind that this virus is transmitted by droplets. So big secretory or water droplets that we expel when we cough, when we breathe, when we sing, and those things. And those big droplets stick to the inside of the mask. And so you're not re-inhaling them after you've expelled them. And even if you were, there's no, scientific basis that would cause a problem. You already have the virus. And so really I can't think of any scientific plausibility that would cause an issue in terms of reactivation of viruses or re-inhaling your own coronavirus.
The last two I want to talk about have to do with science. The first one is that masks are scientifically inaccurate, and that COVID-19 is being measured at 80 to 140 nm in size, making the weave of material masks to be equivalent to a chain link fence to a mosquito. So it's saying that if you're trying to not get a mosquito bite, a chain link fence won't help. So if you're trying not to get COVID, a mask won't help.
Yeah. So let's break these two apart in terms of there's no scientific evidence that masks work. So the first one, there was a recent article released in Lancet. Lancet's the really large medical journal out of the UK. It's incredibly well respected on the same level as New England Journal of Medicine here in the US. They just published a review article. It's online. Anybody can go and review it to show the benefits of actually wearing a surgical mask or an N95 mask. Granted, we don't have a ton of data on homemade cotton face coverings, but we can extrapolate from the surgical mask data, showing that yes, indeed, wearing a surgical mask does help. It does decrease transmission and decreases the risk of you getting infection. Okay, so there is clear scientific evidence that masking helps in the time of viral transmission. Now, the report that you talked about, how the virus is so small and a mask is much larger. So what they're reporting out is the size of a virus under an electron microscope. Okay, so yeah, that's true. Viruses are absolutely tiny. But keep in mind that the viruses are transmitted by respiratory droplets. Okay, so the virus is essentially being, carried by a big respiratory droplet, which is much larger than the size that you quoted. And so you really have to compare apples to apples, and the fact that respiratory droplets absolutely 100% get blocked by face coverings and masks, and that's what protects you. You can't compare the size of a single virus to the size of your mask weave. And so it really has to be a respiratory droplet compared to your mask. And those, it's not a comparison. And so yes, masks work, and they work in terms of preventing transmission from an infected person out in the environment, and most likely will give you some level of protection as well in terms of when you get exposed to the virus.
Something interesting I want to talk about too. Yesterday we posted a video which was created by the National Institute of Standards and Technology, which showed a visualization of droplets when you were wearing a mask, an N95 mask, a cloth mask, and no mask, a bandana, and then wearing a cloth mask incorrectly. And it kind of showed the viral load of like how much stuff actually happens when you're talking or even just breathing. And I thought that was really interesting. So we'll share that again. But
yeah.
Is there anything else you want to mention about masks and just the importance of wearing them regardless of what happens with Salt Lake County? The fact that everyone should be wearing one anyways.
Yeah, it's a simple message. There was a study that was just released in a journal called Health Affairs that looked at the states that mandated masks and looked at what happened to their epi curves in terms of COVID-19. And they definitively showed that a state mandated mask order actually reduced COVID-19 cases in their states, and it correlated with the time that mandate had been in place. And so, I'm not saying that the state mandate is the way that we have to do this, but it just shows it's another level of evidence that universal masking can really impact an epidemic like this. And so this is just common sense. This is not political. This is just common sense. We need to protect each other from this virus. And there hasn't been a more important time for us to do that than right now. When we see cases going up exponentially, going up from 200 cases up to 600 cases a day, we have to course correct. We have to do something right now if we want to really change the trajectory of this curve. And one of the things we all can do is we can wear a face covering. And that's just a sign of respect for others and yourself in terms of preventing transmission of this virus. I also want to make sure that we don't lose focus on this keen focus on masks. I don't want us to lose any focus on the fact that social distancing or physical distancing is the primary mode of affecting this virus. Okay, so just because you wear a mask doesn't mean you can go out and you can engage with the community like you had at one other time. We have to continue a focus on our physical distancing. We have to continue our focus on decreasing the amount of close contacts we have. And then if you need to go out into the community and are in an environment where you can't do physical distancing, that's when you wear a mask. And so it first is reduce the number of close contacts with focusing on physical distance. Second is if you have to go out, you need to wear a mask, and you also need to do good hand hygiene. It's those three things, but the thing that we all can do is we can all wear a mask when we're out in the communities, especially in areas where we can't physical distance.
Okay, I have a few more questions. I just went and looked at the comments from the post we posted yesterday.
Yeah.
I want to address a couple of things really quick. So I know that in your press conference 2 days ago, we talked about the fact that if you are someone who thinks they cannot wear a mask, they probably shouldn't be going out in public to begin with. Are there any instances, like real instances, where someone should not wear a mask?
I was reflecting on that question. I think Dr. Briesacker took it, which I was thankful for.
Sorry, now I'm asking it to you.
Yeah, there really aren't instances where a mask is 100% contraindicated. We know oxygen travels well through a mask. We know CO2 travels well through a mask. And so even those with COPD, so bad obstructive lung disease, emphysema, those people are still safe to wear a cotton face covering or a surgical mask. That being said, those are the exact person that we do not want out in public. We need those people at home, because those are the people that are going to do absolutely terribly with this virus. And so if you think you're in that category where you don't think you could wear a mask because of underlying lung disease, that's ever more the reason not to go out in public. That's the reason to stay home and practice physical distancing. The other group of people that I think could struggle is those that have a challenge with anxiety and also with kind of claustrophobia. You have that feeling where you're being enclosed, and that's real. At the same time, wearing a mask, it takes a little bit to get used to, and so the more you wear it, the more comfortable you get, and it's something that comes with time and some practice. And so there's really very few people that medically can't wear a mask.
That's good to know. Okay, two more things for you. So I want to address the fact that when people are looking up information on masks, when they're pulling this data to educate themselves, that they need to be really careful of what sources they're looking at. There's a couple of links on here that I haven't clicked on them, so I'm not 100% sure where they're coming from, but it doesn't look like they're scientific websites. It's either a blog site that they're posting or someone who is not medically trained in this situation. So we'll talk about the importance of where you're getting the information from.
Yeah, there's a lot of armchair scientists and epidemiologists out there, especially when we have access to Twitter and Facebook and those things. Be real careful of where you're getting your information. Be really mindful of testimonials of one person giving their experience. We really need to focus on science right now and focus on experts that do this for a living and have studied this for a living and are unbiased people. And so really focus on getting good information. So areas to think about: CDC has great resources. along with WHO, intermountain.net, or pardon me, intermountainhealthcare.org. All of these places have reliable information. Any healthcare network are going to give you the most reliable, up-to-date information on masks and COVID-19 in general. Be really mindful of social media. There's a lot of people that think they have a lot of knowledge in this area, and they don't. And so be careful where you're getting the information.
But if you are going to be on social media, listen to you, because you've been really great
there you go.
to make sure that we answer all the questions correctly. The last thing I want to address really quickly is that people think that we're increasing testing, which is why case counts are going up. Do you want to talk a little bit about that?
Yeah, I'd love to address that. People can say that all they want. They just need to look at the data. Our testing has plateaued, and it has been plateaued for the past about 45 days. We test anywhere between 3,500 and 4,500 patients per day. And what we look at is the test positivity in that. And so, one, our number of tests haven't gone up. And so you can look on the Utah Department of Health website. Intermountain has our own data. The number of tests have been flat for the past 45 days. So we had not increased testing. And when you look at the percent positive of tests done, we were at 4 to 5% for a long period of time. And May 27th came, and we're now up to like 9 to 10%. And so it's incredibly clear that this is not a testing issue. We're not going out testing more people and finding more positives, which is increasing our cases. If that were the case, what you'd see is your test positivity rate go down. But we're actually looking at the same amount of tests that we've done for the past month and a half, and we're seeing an increase in your test positivity, which is just an indication that we have more community-based transmission. And that's the same in many of these states, whether it be Florida, Texas, Oklahoma, Arizona, that have these higher rates.
Eddie, is there anything else you want to mention to us today before we let you go?
Just mask up. If you're going outside, wear a mask. Please wear a mask. We do this for other people, and so we really need to focus on why we're doing it. And so, I wear a mask to protect our Intermountain employees. So if I'm in clinic, which I have this afternoon, the minute I walk in that building, I'm going to be wearing a mask, and I'm not going to take it off. And the reason is if I'm unknowingly infected and I go into my infectious disease office and I infect our ID physicians and our ID nurses, all those people are now out of commission. And so we mask for other people. And so if people are saying, I'm not going to wear a mask, well, that's just reflected on you. It's reflecting on your thought about how you are treating other people. And so it is something you really need to think about why we wear masks. We wear masks for other people. That's why we wear it. And so put a mask on if you're going outside.
Well, thank you, Eddie. I really appreciate the time. And a couple of quick phone numbers for you guys. The COVID-19 hotline, which is still available, you can call it at 844-442-5224. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thanks, Eddie. We'll talk with you next week.
Thank you.